Hey guys, happy May the 2nd. Today I'm going to talk to you about my diagnosis and a couple of things to explain how it all came about. I was diagnosed in October of 2004, and how it was found was from blood work that my family doctor had done for me. And the reason why we did the blood work was because in my own opinion, I know I wasn't healthy. I was overweight, I didn't feel good, so I decided to start working out. And I was working out on a daily basis, eating better, doing all of these things. And after a while, I started to get these bruises, which I kind of just chalked up in the beginning to just, working out, doing things I'm not normally used to doing, the machines, different things like that. Well, I was starting to get these bruises that were the size of baseballs on my leg. And they hurt so bad that even to get a shower almost brought me to tears. So I called my family doctor and he scheduled some blood work. I went and had the blood work taken, and that's how we found out about the CML. He had called me and asked if I can leave work to come in because he wanted to talk with me. So I went into his office and he did explain that my white blood count was extremely high. The normal range is the low numbers. I had over 135,000, and that was what was causing the bruises because they had nowhere to go. So they were basically just clumping up and forming, and they were becoming a big solid mass. And because of that, that's how we found out about the CML. So he said, I do have CML, and was telling me, you're gonna have to go into the hospital, we have to start treatment right away. And at the time, I did break down because, you're not ready to hear that. It's not, something you normally hear. And the minute you hear cancer, I think in your mind, you just go to that dark place where like, oh no, now I'm going to, pass away, because that's what you think of so much when you hear the word cancer, is that automatically just you're going to die. And I did have a little bit of a breakdown, and then I was done, took a breather and said, okay, what do we have to do to go forward? I got home, spoke with my family, my mom, my sister, my dad, my only nephew at the time, Scotty, and explained to my mom what was happening. She had called my family doctor because they're great friends of our whole family for our whole lives, and he was talking with her. And in the meantime, he got in touch with an oncologist, and she said, no, you come and see me, don't go to the hospital, and we're going to talk about it. So we went to see her. My mom had come. We went to talk with her, and she explained everything that there was to be explained. She went over the numbers, went over what it means and everything. And I would encourage you to get a second opinion, regardless of who the doctor is, how great you know them. My family doctor is amazing. I absolutely loved him. He was great, and I trust his opinion. But even he said, get another opinion. So he sent me to the oncologist, which she confirmed it. But the next day I had to go for a bone marrow biopsy. I've never had one, had no idea what it was. This was all new, no clue what was happening, what to do. And I remember my mom and I sitting in the waiting room before the biopsy, and she said, do you know what it is? Did you look it up? Did you want to talk about it? And I'm not one of these people that does research, because in my opinion, what someone else experienced doesn't necessarily mean I'm going to experience that. So if I read something that happened to someone, it may or may not happen to me. So that's just one more thing I don't need to have compiled on top of what I already had going on. So I had no idea what a bone marrow biopsy was. And thankfully, my mom and my dad are in the medical profession. My dad was an EMT. He was a volunteer firefighter. He knew a lot of doctors, a lot of nurses. He was a volunteer. He worked for, an ambulance service. So he knew a lot of things, and he knew a lot of people. So he was aware of, about CML, what a bone marrow biopsy was. My mom is a certified nurse's aide, so the same thing with her, knows doctors, nurses, knows a lot about things. So they were well versed in, some of the process. Me, on the other hand, I had no idea. And I was 26 years old at the time when I found out. So I thought, well, let's just, I have to have it done. I don't know what it is, and I don't really want to know what it is. Let's just go and experience and see what it is. And they did give me the option to be, if you wanted to get medicine or to be, slightly sedated or anything. And I said no, only because I didn't know what it was. I didn't know what it involved, what it entailed. And if you want to know what a bone marrow biopsy is, I would say look it up. I don't want to explain it because it could be rather, for people who don't like needles or anything like that. It's not the best procedure. They do it in the back of your tailbone, and it's a very large needle. They have to go into the bone itself to be able to extract the marrow, and that's how they get 100% diagnosis on if it is like CML, because that's where it resides, is in your bone marrow. So we did that, and it came back positive for the leukemia. And so my oncologist said, these are our options. They had a new medicine that had just come out, and its name was Gleevec. And it was basically almost like a chemo pill that you take rather than going for chemo. So we started off on that, and it was 400 milligrams. And the purpose of that was to hopefully get you in remission just by the 400 milligrams. In the meantime, my oncologist set me up with a transplant doctor in Philadelphia in Jeans Hospital, and his name was Dr. Mangan, and he was the head of the department. And we got to go visit with him, and that was basically my third doctor confirming that this is what it was. So it was basically family doctor, oncology doctor, and then transplant doctor. So for me, that was good because it was 3 different people, coming up with the same diagnosis. So always, I would say, get, another opinion. So we went to go visit him, and he explained that right now my options are to take the Gleevec and see where that leaves us. We didn't talk about a transplant. It was just way down the line in the future. It's basically a last minute type thing. So he said, we're going to try the Gleevec. We're going to keep up with you, see how you're doing in case something happens. You'll already be in the system at the transplant program, and we'll go from there. So I started off with the Gleevec. I went 400 milligrams every day. I got my blood checked once a week, like every week religiously, just to see how well the medicine was working. And I took the Gleevec 400 milligrams for about a year and a half, and I had no side effects whatsoever. So I was very thankful for that. I basically was living what you would say is, your normal life. I didn't experience really any side effects. I was tired here and there. I still continued to work out and do different things, but it wasn't hindering my life in any way. So we did the 400 milligrams, continued with the regular blood work, and then it came to the point where the 400 wasn't working. My white count was going down, but not as significantly as it should be, as opposed to how it was working for other people. So it came to the point where we went to 800 milligrams, and that was basically the max. So at that point, we're hoping that the 800 will put you into remission. So we did that, did the 800, and it was working. The white count was coming down, but then it got to the point where it became stagnant. And it wasn't what they would call like a molecular remission, because they would continuously do the bone marrow biopsies to see, this is my bunkie, my baby, to see if it was working and how well it was working. And it was working, but not well enough to what they would believe to keep me in remission. So we had the decision to make whether or not I was going to go ahead with the transplant, because basically at that point, since the Gleevec wasn't working, and that was basically the pill and chemo of all chemo at the time to put it into a remission, and that wasn't working. So basically it was, okay, it's time, we have to talk about getting a transplant. And my mom and my sister did research. I, on the other hand, did no research. I didn't want to know what it entailed, what it was going to be. I mean, we went down And we talked with the doctor, and they explained everything and said, here's where we're going to go from here. We're going to take you off the medicine, and what we're going to do is put you into a system to see who could possibly be a donor. My sister got tested. Unfortunately, she wasn't able to be a donor because they do these things that are called logs, and they try to get you matched to the closest log as possible. And my sister was only, if you're under 8, excuse me, they won't take you as a donor because they want to get as close to 10 as possible. And I know that she was under. So at that point, I really didn't have anybody else to be able to check. So I went into like the world database. And when I tell you it's huge, it's all over the world. It's not just the United States, it's Canada, the UK, it's everywhere. Any person that decides that they want to be a donor, you could go onto a list, and they work you through it, and like walk you through it and tell you what you would need to do. And I was put through this whole database, and in the meantime I was still feeling well, doing well. You would almost think that there was honestly nothing wrong with me, and I'm very grateful for that, because it could have been a lot worse, because I know people who did have it a lot worse, and people who have cancer now, whether it be leukemia or any kind of cancer, it's not easy. And I think it made it a little bit easier on my family and friends, which I'm so grateful that my friends were actually my coworkers. So on a daily basis, they were there to just keep me focused, because I can still continue to keep working. And they were a huge, huge part of my recovery. Like, I don't know what I would have done without the huge support system that I had, as far as my family and my friends. But to get back to the story, we went into the database. They found about 5 matches, and they had to, once they found them, they had to do a lot more testing and different type of things to determine who would be the best candidate. And it came down to, they found a male who was in his 30s, and he was the best match for me. He was a 9 out of 10, which was the best they felt at the time that I was ever going to get. So it became my decision to when we wanted to go ahead with the transplant. And this was at the point of now, at the end of 2006. And I had asked if we can wait and do it after the holidays, because I wanted to have my holidays with my family, and they said absolutely. So it was scheduled for the end of January. So in the meantime, you do have to get prepped. You have to do a lot of keeping up on your blood work, go to see every doctor you need to see, the eye doctor, an ENT doctor. I had to have like a mammogram. You have to go see all of your other doctors, go see the dentist. You can't have any open, wounds, bruises, nothing. I did have a chipped tooth, and it was the week of Christmas in 2006, and I went to the dentist to have it fixed, and it was fixed. It was just a chipped tooth. He fixed it. Everything was good. Christmas morning, I wake up. I literally looked like a raccoon. My face was swollen. It was puffed out. All of this was infected. Went to the emergency room Christmas morning with my dad, and there was basically really nothing they can do. They gave me an antibiotic, but my face was so puffed out, and it was infected, and I needed to get it rectified as soon as possible, because my transplant was like a month away. I can recall that Monday after Christmas going to the dentist, a different dentist, and it was like, to this day I'm still traumatized to go to the dentist because of this. They had to drain it. It was so swollen. It was so bad. I had to get root canals done in order for my teeth to be saved and to be okay, but they were extremely infected, and it was believed that it was bad needle that the dentist used or something. So in order for the transplant to go ahead, it had to be fixed. The root canals had to be done. There had to be no sign of any type of an infection. And thankfully, by the time it was go time, it was all cleared up. But even to this day, like, I have anxiety for the dentist. I just don't like it. I'm like the biggest baby, but you know, we all have our things. So it came down time to do the transplant, and we were in Philly, Jean's Hospital, Fox Chase Cancer Center, and my doctor, Dr. Mangan, like as I said, was the head of the department. He explained to us what was going to happen. I was going to be in a hospital. You're in a room by yourself, a floor that's completely sealed off from everyone else. To be able to get into it, you need a code. It's very strict. He gave us all the guidelines up into before the transplant and said, okay, well, these are the things that you're allowed in your house, things you can have in your house. No flowers, no like fresh flowers because they can bring in bugs or can bring in germs. There was like very strict guidelines even afterwards, but my mom stayed in Philly. They gave her a room, and she had like her own little apartment. So I remember us going shopping, and she was getting the room prepared and getting everything ready. And my dad stayed down for a couple days. My sister came down. I only got to see my nephew twice in the hospital because he was kind of younger, so they don't want them to bring in any infections. And I could just remember the hardest part about the diagnosis was when he found out. And my nephew Scotty, which I'm sure a lot of you know who he is, he was crying and he was like, is Anton gonna die? And that was the hardest thing for me. From the day that I was diagnosed even till today, I never once said, you know, why me or anything like that. I'm not one of these people that does the whole, you know, I don't want people to feel sorry for me. I know when people hear the word cancer, they think, oh my God, and they don't know what to say. And their first reaction is to say I'm sorry and all of that stuff, which is, it's fine because it's hard for everyone. You don't know exactly how to take it. You don't know what to say to the person. You don't know how to act. You don't know how to, you know, take it, what you just heard yourself, let alone how do you make that person who's diagnosed feel better. And honestly, there's no right or wrong way when someone finds out. It's just a matter of just being there, I would say, for the person. And that's basically what everyone was for me. So my big thing was, I'm glad it was me who had it and not my nephew. Because at the same time, I was sick. My dad was also sick. He had COPD, emphysema, and he had a really hard time breathing. And it was just a rough time because when I was sick, my dad was sick. So my mom, I don't even know to this day how she did it. And she was my caregiver and took care of me and basically moved to Philly while I was taken, like, in the hospital so she could be down there with me no matter what. And my dad was down here for a while, but then he finally went home. And every day she was there. And it really wasn't so bad in the beginning. You're basically in your room and they set you all up. They start you on the chemo, the IV chemo, like have a port put in, which I did. It was put in like up in here. And when they put it in, you're awake. Because they have to make sure that they're putting it in right to make sure how you feel with it and everything. So I had that done 2 weeks prior. And then it's basically easy. It was like 3 little ports so that this way, if they had to inject anything, it was just easy to do it that way because you're on an IV, you're on, you know, if you need blood, any of that stuff. So I got set up in my room. You were allowed to have things that you wanted. If you wanted to bring, you know, a special blanket or, you know, a pillow or whatever, but everything had to be basically clean and sterile because the purpose of the chemo prior to is to take your immune system to nothing. It's basically 0, no white blood count, nothing. And that's what they did. So I had chemo for about 4 or 5 days. And during those couple of days, like, I was okay. I didn't really feel sick, but towards the end, I started to. I was very nauseous and sick. And it came to the point where I couldn't even smell eggs. they would bring my breakfast in, and the second I would smell it, I would be nauseous, I would be sick. It got to the point where I basically just ate peanut butter and jelly sandwiches, because some smells just make you nauseous. Things change when you're in that situation. Your smell changes, your sight, your taste. It's like a whole new world with it, because some things that you smell might trigger becoming nauseous. Some things you eat trigger becoming nauseous, and that's what happened for me. Eggs were just nothing. The smell of cucumber melon, even to this day, it still makes me sick. I got over the eggs, thankfully, but cucumber melon, I still can't do. It makes me nauseous. So I would get a little bit sick, and they would give you medicine for it. It was about the 5th day in, and when you think of transplant, you think like, oh my God, like what is it? What do they do? It's basically just a bag of like their bone marrow that's put, and it takes a really long time. It's very, very slow. It's not something that they administer quickly, because as they're giving it to you, your body has to adjust to it, because it's basically grafting with your body. It's like a puzzle. You're trying to get the pieces to connect. So it's almost like a whole 24-hour, maybe longer procedure for it all to go through. I didn't have any complications from that, which thankfully I was very happy for. I was sick in the hospital. I did start to lose my hair in the hospital. It would be on the floor or on my pillow, and I would just hurry up and pick it up and throw it in the garbage. And one of the doctors that always came to see me, he would always say, he's like, how's my princess today? And, you know, we would talk, and I would talk to him about my hair, because he would say, did your hair start falling out? And I said, yes. And he said, don't be embarrassed. Don't be ashamed. It's something that happens. It's okay. Because I would just like hurry up, pick it up, and throw it in the garbage. And he's like, someone will clean it up for you. You don't have to do it, you know. And I'm like, okay. But at the same time, you know, you're taken a little aback by the fact that your hair is falling out, and it's never happened before. So as part of the transplant, what they do is when they take your immune system to nothing, it's called, you become neutropenic, which means you have no immune system. So your door has to be shut. Every person who comes in has to wear a mask, gloves, everything, like top to bottom, because you can't get an infection, because if you do, you have a high risk of dying from that, because you literally have no immune system. It can't fight anything off, and it starts to build back up as the bone marrow grafts with your bone marrow. So it depends on how long your door is shut for, or that you're neutropenic. It's just there's no time frame. It's every person is different as far as that goes. So it's up to your body, basically, when the white count starts to come back up, that it's grafting and it's working, and then you can continue, then you can start to like build back up your immune system, and the door comes open, and you can start walking around with a mask, and they check your blood work. Like everything is checked constantly, all day long, 24/7. They're checking everything to make sure there's no complications, that nothing is happening. And thankfully for me, it wasn't so bad in the hospital. The grafting went well. I was in the hospital for my 30th birthday. The doctor did allow my mom and dad and my sister and my nephew came down for my birthday. And you're not allowed really anything from the outside. No balloons, no anything like that that can bring in a bug or germs. He did allow her to make me homemade food. She had to tell him everything that was in it, and everything had to be cooked. Because after your transplant, when you go home, you're 100 days basically quarantined. And it means that you can't see anybody for 100 days other than when you're going back to see him. And you have to wear a mask. I couldn't have visitors or friends. Basically, the only person I saw was my mom, and occasionally my dad or my sister and Scotty, but not for very long. And I didn't see Scotty a lot because he was a child, so he is a huge high carrier. And so basically I only saw my mom, and everything had to be cooked. You were not allowed to have any fresh fruit, no raw vegetables. no yogurt, no sour cream, no salad mix. Anything that can have any type of bacteria in it, you're not allowed to have. So I wasn't allowed to have anything like that. Everything had to be 100% cooked. So he did allow her to cook me dinner and bring it in. I can remember it was raviolis, these homemade raviolis, and she was allowed to make me a birthday cake. And she had to tell him like list of ingredients of what was in everything, and he had to approve it before I was allowed to have it. So I did celebrate my birthday there. My friends from work helped celebrate with me. They were amazing. They gave me cards, gift cards. They checked on me always to see how I was feeling, how I was doing. And I would say one of the biggest things of when you find out is the support system that you're going to have, because you might feel okay today, but tomorrow you may not. And it's good to have people who understand that in the matter of a couple hours, things can change and you can go from feeling amazing to just downright being sick. And thankfully, I was not with any of the medication that I took. So I'm really appreciative for that. I'm so appreciative to my family for just taking care of me and doing everything for me. And it was a big deal, because with my dad being sick at the same time and his struggles and his doctor's appointments, my mom basically was taking care of me and Philly and trying to help take care of him. That was 2 hours away. Sorry, my cats are being little boldies. So that's basically how that all started, was finding out, the treatment that he had to go to, the process that he had to go to. I mean, it's hard to hear. So anybody who's experiencing cancer, or someone who is a caregiver to someone who has cancer, you are the biggest person and the biggest cheerleader that anybody can have. I just want people to realize that sometimes people are sick and they don't look like they are, but there's other things going on other than what you see. Because for me, it took a long time for me to look sick after my transplant, because everything was going so well. I was, doing my 100 days out, which, sorry, Connor, that it meant nobody can be in the house and do different things. And I would say always listen to your doctors. If they tell you don't go out for 100 days other than to come see me, then don't go out for 100 days or whatever that they tell you to do, because they're not, in the long run, it's beneficial for you. Because could I have gone out? Probably. Could I have had people over? Sure. But at the same time, after going through all of that, why take any type of a risk? It's not worth it for your own health and for somebody else. I was in a relationship during my transplant, and we were actually engaged. And after I found out, and a little while after, I broke it off, because it wasn't helpful for me. And I just want people to realize that when you get diagnosed with whatever it is, you have to put yourself first and foremost. Your main concern has to be yourself. And if you're with someone who just can't handle you being sick, or being able to handle it, or whatever, if they can't be your support system, then you have to figure out a way to remove that person, or say you have to step up, or just be better. But it didn't work for me with that person, and it just became extremely toxic. So I ended up it was just being with me, like myself. Like, I lived at home, and thankfully my mom and my sister and my dad and Scotty lived across the street, so it made it so convenient. I did have a dog at the time, and Akita, his name was Odin. And when I was away, my dad watched him. And in the beginning, we weren't sure if I was even going to be allowed to be around him for those 100 days when I came back. But because he's not an outside dog or anything like that, he's strictly just indoors, I was allowed to be with him after my transplant, which I'm so thankful for, because he was just like my everything. He was my support dog and took care of me, and he knew when I didn't feel well, and he was just always with me. And I'll do a blog post and I'll show some pictures of, sorry, of just different things about like when I lost my hair, and just different little things to add some pictures to it. But not long after my transplant, I came home in February, and my sister was getting married that same year. And I was a little worried because I didn't have, my hair was falling out and stuff. So the day that I got home, I was at my parents' house, and literally just to touch the couch like this with my hair, it hurt so bad. My head, it just, you couldn't even do this to it, and it didn't hurt. So I had said, like, I'm done with this. I'm done. So I got my dad's razor, went into the bathroom, and just started shaving my hair. And it was about as long as it is now, maybe a little bit longer, and just shaved it off. And I can remember my mom crying. My sister was like, is this really happening? And Scotty at the same time was kind of like, whoa, this is like cool, and because, he really didn't understand what was going on. But at the same time, I didn't want him to be scared. So I'm like, hey, we're going to cut my hair off, so it's going to be better. And so I did. I just literally shaved my own hair off because it hurt. And I know people get embarrassed when they lose their hair, and they think, oh my gosh, how am I supposed to go out and everything? And I say, look at it this way. You lived. You're alive. Your hair doesn't make you who you are. You're who you are. I could have worn wigs and stuff. I opted not to. It was winter, so I basically just wore hats. So I didn't do the wig route or the bandana route or anything like that. It was basically, this is my hair. This is how it is. I have none. And honestly, I'm just happy to be alive at this point, so I really just don't care about having no. That was basically my attitude through the whole thing was, let's just do it. Let's just take it. Let's just see how it's going to be, how it's going to end. And that's it. I didn't want to overthink anything. I didn't want to worry about, well, what if this happens or what if that happens? Because when you do your initial talk with the doctor, they do give you like a therapist or someone that you can talk with or call on a daily basis, 24/7 therapy type of thing. And you can do classes down there, and they take you around and they say, listen, if you need someone to talk with and all of that stuff, there's support groups. My mom and I had the privilege to be able to sit in on one of them, and I was one of the youngest people in there. And I just hearing all of their stories and listening to them was just, these people had gone through so much, and they're saying what they went through, and like what a family member went through and all of these other things. And a lot of people were asking questions like, well, how did you handle this, or how did you handle when that happened? And for me, I was just sitting there thinking, but if it doesn't happen to you, then you're sitting there stressing, worrying about something that didn't even happen. So for me, that was just in my mindset. Like, I know other people aren't like that. That's just how I was, that I didn't do that. Because basically my train of thought was, and kind of still is, whatever's happening is happening. There's not really much you can do about it. It basically is what it is. So the goal is to figure out how to go forward with it and figure out what to do and how, you're supposed to navigate that and not really worry about so much of, what happened with someone else and what things that they've experienced, and worry about, well, what if that does happen to me? Because what if it doesn't? So then you just kind of spend a lot of energy worrying as opposed to trying to go through the next day without worrying about, well, what if this does happen? And I'm just not one of those people. I always see the glass half full as opposed to half empty, because I don't really see the point in having not negativity, but just looking at things. So I don't know, to me, I'd just be happy that I have a half a glass of water left as opposed to a half a glass being already gone. I guess that's just how I try to be. I try to be a positive person and uplifting, and that's just my personality. That's just who I am. When I first was diagnosed, I mean, it was hard for everyone around me, especially my mom, because my Nana also went through cancer and she had cancer. Um, so it was rough. Like, my family story is a story. Like, I could give you stories about like illnesses and everything, but it's just a lot. It's a lot to take in. My mom basically took the burden of all of that. So that's why I'm so thankful for her every day, because I know they say that's what parents do. Your mom's supposed to take care of you and all of this. Your parents aren't supposed to sacrifice who they are to take care of you and stuff. Like, they're not supposed to. Like, it's not a job that they have to do. And it's something that we need to appreciate, that what they do for us regardless of how old we are. Like, I'm 46 now, so there's my age. And my mom still takes care of me and comes to my doctor's appointments and goes with me to hospital visits. I was just up in Philly 3 weeks ago to see the transplant doctor again, and she went with me. So it doesn't matter how old you get. If you have a parent or a friend or sister, brother, whomever that sacrifices everything that they have to take care of you, then without even asking or not feeling like it's a burden or feeling like it's a chore, then that's just a special person in your life. I mean, you can't ask someone to go above and beyond and do those things for you. It just has to be something that someone does. So my big thing is have a support system, have people around you that are going to make you feel good, that you shouldn't have to worry about making them feel better. You have to take care of yourself, and that was my main thing. Like, I had to put myself first and foremost. So I got out of a toxic relationship because I needed to put myself first in order to get better. So for me, everything was, what do I need to do? How do I need to do it? And how do we make it better? And I truly am very lucky that my transplant was successful, knock on wood. And at my last appointment that I went to a couple weeks ago, he said that I am 100% in remission. There's no signs of it coming back. His exact words were, it's never going to come back, but you can't really say that. But hopefully that's how it's going to stay for the rest of my life. But being that it's in remission and the leukemia part is gone is like the best news ever. The only downside of a transplant is what happens afterwards when your body's trying to graft that new bone marrow that it got. And I'll talk a little bit more about that because I feel like this is a huge video that I'm talking about, the beginning steps, the process, feelings. I was scared, obviously, but not so much scared that I thought like, oh, something bad is going to happen or this isn't going to work or anything like that. Like, I put my trust in my doctor, and whatever he told me to do, that's what I did. And some people think like, oh, that's naive. You got to read about stuff or know about things. And I just thought to myself, it's good to be knowledgeable, but then there's a point to where you become obsessed. And I didn't want to be that person. I don't want to be the person that says, oh my God, like, this can happen to me, and just worry about something that actually didn't happen yet. So I guess my advice when you find out that you have cancer is take a beat, take time for yourself, and really think about it. And maybe, perhaps don't ask yourself, why did it happen to you? I know a lot of people tend to do that and say, why me? And there's nothing wrong with that. I mean, honestly, like, you wonder, why does it happen to you? My big thing is, don't get so hung up on that you lose focus of how you want to proceed. Don't let the cancer beat you. Do what you can to win the battle, even if it seems like today the battle is never going to be won. You don't know what can happen a week from now, a month from now. And I know not all cancer is curable, and some people, unfortunately, we lose them to cancer. I lost my Nana to cancer. My dad passed away from, COPD and stuff. So things do happen, and regardless of how hard you do try, in the end, sometimes the disease wins. But at the same time, don't give up fighting, because it's one life. I, you just at least look at the fact that if you wake up every day and to enjoy the things that are around you and the people who are around you. And it's hard because not every day, is all sunshine and butterflies. But at the same time, it doesn't have to be so, grim. Because when people hear the word cancer, that's the first thing they think of. And I would say if a friend of yours says, I have cancer, be supportive, listen to them. If they want a little bit of space, it's not because they don't want to talk to you or they don't appreciate the help that you're ready to offer them or to give them. It's just because they're so overwhelmed. And a lot of times, if we're diagnosed, we don't know how to make it better for you, our loved ones. So it's a battle because you're trying to make it better for us, and at the same time, we're trying to make it better for you to show you, okay, we're okay, it's going to be okay. And it has to be kind of like a good medium. So I would say don't get upset with someone who has cancer if they just don't want to talk, or, even if they say, hey, I'm having like the best day or a good day, just like let them have that. And don't, I know it's not easy, but don't constantly say, how are you feeling? How are you? Do you need something? Because after a while, it kind of gets not redundant, but after a while of constantly keep hearing that from so many different people, you kind of get to the point where you don't get annoyed. I don't want to say that because I don't want it to come off like you're ungrateful or that I was ungrateful for people constantly asking. But you're trying to process it and move every day forward with it. So at the same time, if people are constantly asking you, it's kind of like, a tennis match. You just keep hitting it back and forth. Just go about treating the person like you would have normally treat them before you found out about the diagnosis. I mean, when I was working, I still continued to work up until my transplant, thankfully. And, that's what I asked. A lot of people said, what do you want, or what can I do for you? And that was my thing. Just treat me like you would any other day of the week. Nothing different, nothing special. I want to just continue to keep laughing. I want to continue to go through the day, get up in the morning, get a shower, eat breakfast, and not my focal point be the disease. I want to continue to live my life, we'll work on the disease, but at the same time, I want to keep living my life towards the end goal of what are we going to do to make it better, or what are we going to do to fix it or not fix it, or if this is something that I have to live with, but we'll take that as it comes. So I guess, I don't know, at this point I'm probably just babbling, but that's literally up like how I found out and the process a little bit. And there's a lot of blood work involved, and just making sure that you're taking care of yourself up to the transplant. And then I will talk on my next video about what happens when you're 100 days out from your transplant and things that I had dealt with. But if you have any questions, let me know. Direct message me, put them below. Just let me know. It's just a little bit of what I went through for about 3.5 years, from finding out to taking medicine that didn't work to the end result having to be the transplant because I had no choice. But in that process, I met amazing people, amazing doctors. I learned a ton of stuff about myself, of what I can handle, what I can't. Just being closer with my family and friends, and knowing that, you learn who these people are when times are rough, that who are going to be there for you and stick with you and truly mean when they say, what can I do for you? Can I help? But at the same time, also understand that if you need a little bit of space, they're okay with that. And if you don't want to talk about the illness, they're okay with that. So it becomes a happy gradient line to say, you have it, we got it, okay, let's go to dinner or watch a movie. Or it's not that you're ignoring it, but you're still living at the same time. So I hope this was a little informative. If you have any questions about the beginning process, let me know. But if you feel like something is off and you don't feel right, tell your doctor. Go to them. And if they're not listening to you, go to a different doctor. But always make sure that you're being heard. Because if I didn't get those bruises, I would have never even known. So I'm thankful for my doctor listening to me when I said, hey, I think something's wrong. What's going on with these bruises? For him to be like, all right, let's just do some blood work. I didn't have to beg him, and I didn't have to call him multiple times. It was one time to just say, hey, I don't feel good. Something's wrong. For him to say, okay, let's check it. And he didn't bypass me. So make sure you have a doctor that is like that, who will listen to you and be there for you. And don't be afraid to ask questions, because sometimes they're so overwhelmed. They just think, oh, it's, normal sinus infection, or it's a normal anything, or it could be something more severe, or maybe not. But just make sure that you're heard. And I guess I'm going to sign off because my kitties are going crazy now. But if you have any questions, let me know. I think I'm going to do a little bit of a blog post to show some photos, just like me with no hair and my sister getting married, and just a couple different things to show how life still continues to evolve and keeps going, even though you're still going through other things. And if anybody has any questions about what my mom brought with her when she went to stay away, or if you want, we could do a Q&A with my mom about how her as a caregiver, it was for her so overwhelming, especially being with me being sick, my dad being sick, and just learning, doing everyday life. She took family medical leave to take care of me, and it wasn't easy for her because that was money. And I know a lot of people said, why don't you do a fundraiser? And I know that's one thing a lot of people do. For me, it wasn't so much about being embarrassed. I think it was so much about, I really don't like the attention, so I didn't want people to say, oh, I'm so sorry, or feel bad for me and everything. If I could do again, I probably would do it, a fundraiser, because it does bring recognition. It's not so much about what you get from it, it's about people seeing what's going on outside the norm. But there's things I would have probably have done differently as far as that goes. But my mom did take care of me and my sister and all of my friends from work and my dad and Scotty. Like, I wouldn't be here if it wasn't for all of them, and especially my cancer doctor, Dr. Mangan. Unfortunately, he no longer practices because he retired, but he was like the head of the transplant department, so I lucked out in getting probably one of the best doctors in the world, and just being surrounded with people who care so much. But I'm going to do more videos, so especially from the 100 days out, because I think that's important and significant, so people realize what starts to happen after the fact. I mean, up to, it kind of wasn't so bad. I know it's not like this for everyone, but for me, it wasn't so bad. It's after the 100 days where it just kind of plateaued a little bit, but I'll explain on the next video. So thank you for watching. Any questions, let me know, and I will see you soon.